Spontaneous coronary artery dissection, we shorten it to SCAD, is an uncommon but not rare cause of heart attacks. Patients get a bruise or bleed that builds up in the wall of a coronary artery and actually compresses the artery from the outside so that the blood can't flow to the heart muscle, and this causes a heart attack.
Here we see a coronary artery in cross-section, showing how a SCAD begins with a bleed between the layers of the artery wall.
Sometimes, as the pressure builds up, the bruise tracks along the artery wall. The pressure in the false lumen sometimes leads to a fenestration or tear between the false lumen and the true lumen. While this depressurizes the false lumen and can be a first step towards healing, the flap of arterial wall at the site of the fenestration can sometimes block or reduce blood flow in the true lumen. SCAD patients often present with symptoms commonly seen in patients with conventional atherosclerotic heart attacks, including chest pain. However, they may also report pain in other locations, and some may not have chest pain at all.
There are still a lot of unknowns about what causes SCAD. We understand that there's probably a role for female sex hormones in determining the risk of some patients. It's a condition that occurs around the time of the menopause in women and after delivery of a baby in some women. There's some association with emotional stress sometimes, and in a small number of patients with more extreme types of physical exercise.
Research has found some risk genes associated with SCAD which have an influence on the glue that holds together the cells in the wall of the artery and how clotting happens in the artery wall. This is helping us to understand why some people are at risk of SCAD and others aren't.
SCAD can happen again. It's not that common. Current data suggests around 10% of patients will have a recurrent SCAD within a 5 to 10 year follow-up. You've got to flip that on its head, and then actually 9 out of 10 are not getting a recurrence in that time frame. It's an understudied condition, and it's a sometimes unrecognised condition, and that's why it's important for everybody to learn about it and know about it, because SCAD is a condition that predominantly affects young to middle-aged women, so around 90% of patients who have SCAD are female. Of those, about 1 in 10, maybe just less than that, have their SCAD in association with pregnancy. Around 10% of patients are male, and these are a very important group, partly because they're not impacted by those cycling hormones which obviously affect our female patients.
We think around 4 to 6 people in the UK have SCAD every single day, and around half of all heart attacks occurring in late pregnancy or in the first months after childbirth will be caused by SCAD.
Sadly, too many SCAD patients are missed or misdiagnosed with things like anxiety, indigestion, or cocaine use when they're actually mid-heart attack.
So how is SCAD diagnosed? It's really important to talk to the patient, because SCAD has a significant impact on patients in terms of causing heart attacks and causing admissions to hospital, as well as more rarely more serious presentations.
It's also important to note that ECGs can be normal during a SCAD heart attack, so it's essential to do a troponin blood test. A positive troponin test should be followed by a coronary angiogram to confirm or exclude SCAD.
SCAD outside the context of a raised high sensitivity troponin is incredibly uncommon. If the troponin is normal, that is not SCAD. So it's what the patient says, it's that ECG, and it's the troponin. Those are the key things, really.
Have a raised index of suspicion. Few SCAD patients look like classic acute coronary syndrome patients, even if they have classic ACS symptoms.
despite the recurrence risk, which is something that obviously patients worry about, it's important to say that the prognosis from SCAD is very, very good. And part of the reason for that is that SCAD tends to cause small injuries to the heart in most patients, and that's why patients, even those who are unfortunate enough to have recurrent SCAD, do very well with the support of their medical teams.